There has been a revolution in the way we think about schizophrenia and brain activity. For the past 3 decades or more, we believe that schizophrenia was associated with hypofrontality of PFC activity and hippocampal damage. Now studies using imaging, post-mortem cell-specific anatomy, and anatomical models in basic science experiments have suggested abnormal hyperactivity in the hippocampus and prefrontal cortex, driven by a loss of interneuron-driven organization of activity states. In my talk, I'm going to present data from animal models that correspond closely to clinical studies in human subjects and provide a circuit-based framework for understanding how interneuron loss can lead to activity changes that underlie dopamine-mediated psychosis. The model I'll be using is a MAM developmental model of schizophrenia in which a mitotoxin is given early in gestation, approximating what would be the second trimester in humans, which is a sensitive period that often corresponds to pathology in schizophrenia. Now, the MAM developmental model has a number of different criteria that have been used that have suggested a correspondence with what we would expect for an animal model in schizophrenia. For example, anatomical studies show thinning of limbic cortical structures and increased cell packing density in the same areas that have been reported in schizophrenia patients. As far as behavioral evidence, there's impairment in pre-pulse inhibition of startle and reversal learning, an executive function that's also known to be impaired in schizophrenia, and also pharmacological evidence, such as the hyperresponsivity to PCP, which we know occurs in schizophrenia, and increased locomotion to amphetamine, and especially the increased locomotion that only occurs in the adult, not in the prepubertal stage. The increased locomotion to amphetamine is something that we focus on because the schizophrenia patients from studies by Anissa Abidargam and Mark Laruelle have shown that in schizophrenia patients, amphetamine causes increased dopamine release compared to controls, and the amount of abnormal increase corresponds to worsening of psychosis. So in the MAM model of schizophrenia, what we find is a disruption of hippocampal gating that leads to hyperresponsivity in the dopamine system, the same type of hyperresponsivity that's been seen in these imaging studies. The hyperresponsivity is thought to underlie the psychotic state in schizophrenia, since drugs that mimic dopamine tend to worsen psychosis, and drugs that block dopamine tend to be very effective at treating the psychotic state. And emerging evidence from Carol Tamiga and Stefan Heckers and others suggests that there's hyperactivity in the hippocampus and that this may correlate with the psychotic state. The premise is the hippocampal hyperactivity may underlie dopamine system dysregulation in schizophrenia. Now, what's the relationship between hippocampal activity and dopamine system function? Well, what we find when we look in MAM-treated animals is that the hippocampus, especially the ventral hippocampal subiculum, shows hyperactivity in that there are more neurons firing faster, and that this seems to be driving the hyperresponsivity within the dopamine system. And it does it in a very specific way. Normally, there are a number of neurons that are spontaneously firing in schizophrenia and a number that are inactive. The number firing seem to be controlled by the hippocampus subiculum. Now, with the ones that are firing at a slow average firing rate. But whenever a organism is exposed to a salient stimulus, what we get is a burst of action potentials driven by inputs coming from areas like the pedunculopontine tegmentum driving glutamate-mediated burst firing. This is the signal, the behaviorally salient output of the system. However, how large the signal is depends on the number of neurons firing, which is the gain. The gain being what is driven by the hippocampus subiculum. The premise is that hyperactivity within the hippocampus subiculum in schizophrenia would cause more neurons to fire and therefore overdriving the gain of the system, so that signals would have much too much prominence and cause a much larger than normal dopaminergic response, which we propose leads to psychosis.